Thank you. And as you said, I am a researcher at Nationwide Children's Hospital in the Center for Innovation in Pediatric Practice. My particular research area is around population health and health equity. And I'm going to talk a little bit about a project that we've been doing that's funded by PCORI, which one of the previous speakers already mentioned, is a funding mechanism, federal, that requires in your application and in your implementation a strong interaction with stakeholders and with an advisory board. The project that I'm going to talk about was designed to examine a natural experiment that was going on around the time we wrote the proposal, which was looking at a change in state policy. So historically, children with disabilities who were covered by Medicaid had been in the Medicaid fee-for-service environment. So they were able to go to whatever doctor they wanted that took Medicaid and submit bills and get care. And in July of 2013, there was a policy change that took those children and families out of the fee-for-service environment and moved them into the managed care environment, which of course had some changes in terms of which doctors you could go to, which services potentially were paid in what ways, and also access to care coordination and some of the things that we hoped would actually improve outcomes in those populations. So our goal was to see what happens to the children and families as they make the transition from fee-for-service to accountable care organizations. And we did that with a mixed methods approach that involved qualitative interviews of families, of teens, of providers, and of payers, of doing surveys of parents using a telephone survey, and then using a claims data analysis to look at utilization. So that is what the study was. As part of the way we implemented it, we had an advisory board, which is required. And what was nice about that advisory board, this is our final meeting, picture from our final meeting. And it was designed to include stakeholders at a advocate level. So we had representatives from groups that advocate for children with disabilities. So representative for Voices for Ohio's Children, representative from Easter Seals, representative from the Ohio Society for Autism. But we also wanted to make sure we had real parents. Because a lot of times you get these advocates from these advocacy organizations, and they're kind of professional advocates and professional panel sitters, and they're a little further removed from the day-to-day life of the parents than you get when you actually have somebody who's not doing that for a living, or doing that as a key part of what they do for a living. So that's a little bit about who we were as a group. This grant was funded at Ohio State and Nationwide Children's and University of North Carolina. One of our leads on the project was actually here and moved there in the middle of the process. But where I want to start is by saying I don't want to talk about that. And that's why I didn't have any real slides or anything, because I didn't come to talk about my research, I came to talk about me, which is one of my favorite topics. The reason I want to do that is because I want to say, as great as everybody has talked about what we need to do a better job of interacting with the community, the reality is for us to do this right as PIs, we also have to change ourselves. We have to be different types of researchers than we're used to being, or than most of us are used to being. So I'll start with a bunch of iMessages. So I'm an epidemiologist, health services researcher by training. I'm a person who is probably happier in front of a computer with SAS open and big data than I am interacting with other humans. But sometimes you have to do that. And so when I took on a project like this, I had to deal with discomforts around having my community advisors, my stakeholder advisors, be my peers in this project. And it's different. You know, a lot of times we say we're going to do some focus groups, we're going to get some feedback from the people, we'll modify our processes maybe, and then we'll do what we're going to do. But we'll say we got their feedback, we thought about it, we kept some of it, we ignored some of it because some of it didn't fit what we were trying to do, and we go forward. And that is what a lot of people think about when they're thinking about having a community advisory board or having a community focus group or talking to stakeholders and that sort of thing. But to truly do engaged research, you have to think of those people who you're working with as your peers, which means you have to deal with some severe discomfort, potentially, as your identity as a principal investigator, PhD researcher, blah, blah, blah. So I'm going to talk about 3 of those real quickly that I had to deal with going through the process of working in this project. First of all, I had to let go, at least in part, of my vision of myself as the expert. You know, me and this team that wrote this great grant, we spent 6 weeks deep in our computers and sending drafts back and forth and editing, and we came up with all these great ideas, and we read all the background literature and all of that. We came up with really good, solid research questions. We got it funded. We knew our stuff. And then we got our group in, and they said, well, why'd you do it that way? And of course, we were able to say, well, you know, this is what the literature says, and this is the right way to do it. And I said, but that doesn't make sense. And rather than being defensive and saying, well, actually, it does make sense, and I can cite all the literature that proves to you that it makes sense, I had to step back from that and say, why do you say it doesn't make sense? So, for example, we had a research question on how care coordination impacted utilization and outcomes, and we were stratifying by children with primarily physical diagnoses and children with primarily behavioral and emotional diagnoses. And we wanted to do that because the healthcare systems that those children interact with are pretty different. The types of hospitals they use, the types of providers that they use, the stigma associated with some of those things are different. So we thought there might be something different here that we want to measure. And every parent in the room said no. All of our kids have both. And we're not willing to say that anyone is bigger than the other. You know, the fact that my child has cerebral palsy, which includes paralysis and developmental delay, neither of those is primary. And I don't want you to put me in one box or another. And so we had to say, okay. We had to go back to our research questions and completely restructure them because they said that wasn't a valid question. And I had to be willing to accept that even though from a methodologic standpoint, from a health services research standpoint, I could argue why it was the right route. There's no point in bringing people in and asking their input if you're just going to then spend your time convincing them that you were right in the first place. So that was a big challenge, was accepting that these people are my peers in this room. They are my co-investigators. And therefore, they have just as much say in how we approach the study as I do. And that was an internal transition that I had to be okay with making. Another internal transition I had to be okay with making was because these people are my peers and part of my research team, I need to speak their language as much as they need to learn how to speak mine. We need to find a language that we can all use. As you know, many of us are used to being in rooms full of whatever we are's, nurses, doctors, epidemiologists, and we speak nurse, doctor, and epidemiologist, and that is our language, that is our culture in some ways. And we get in this room and we have to let that culture go. We can't be that and be truly peers with the people we're working with. So being constantly cognizant of every acronym, being constantly cognizant of every mathematical term. And we had a great group who was very good at saying, stop, I have no idea what that means. And being able to work through the communication to get to the point where we're using lay language, we're not using acronyms, we're asking them when they say something, what do you mean by that? Because we're not assuming that we know what we mean with the words that they use. And that, again, was a change that I had to let go of some of my cultural identity to work in that setting. And then the last one I'll mention that I had to let go of was my deeply ingrained training and approach to be a dispassionate researcher. That emotion is not part of our process, that we need to be fully objective in everything that we do. There were many times in our quarterly advisory committee meetings that tears flowed. that when we talked about how we asked a question, somebody told us a story about being asked that question in a non-sensitive way and how that made them feel and why it made them feel that way. And even though I could explain why, you know, that's the standardized question that's been validated across all these studies and that's why we want to use it, when they told me about the tears that it brought to their eyes when they remembered everything that that question evoked for them, we had to rethink that. And I had to not just think about it in terms of face validity and construct validity and generalizability, but in terms of emotional distress and in terms of what it meant to the people who were going to be asked when we asked it. And I had to actually engage with some of my own emotions and think about how would I feel in that situation. How have I felt in similar situations where who I was questioned in a way that I was uncomfortable with. And I had to go into my own emotional status to be able to connect to the emotions that were coming out of the people in the room. That's not the dispassionate biostatistician that I love being when I'm doing the work that I do. So this project changed me as a scientist. If what you're doing when you're doing this type of work doesn't change you, you're not doing it right. Because you cannot come from a purely academic approach and truly engage with people and expect them to believe that you care about them when you have this wall of degrees and titles and language that creates a constant barrier. And that constantly, I won't say belittles intentionally, but probably belittles unintentionally the people who you're working with, who sit there saying, I didn't really understand anything she said, but I don't want to say anything about it because I don't want to look stupid, so I'm just going to sit here and be quiet. Until you are willing to accept that you don't get points for sounding smart, and until you're willing to accept that you don't get points for sounding objective and uncaring, you're not going to do this well. And so that's, you know, what I wanted to bring to the table is thinking about this from the perspective of researchers who are thinking about getting into this work. It's not easy. And it's not just that it's not easy because of them. It's not easy because of us, because of who we are and what we've been acculturated to as academicians. One of the things that's great about what we did was it worked. Our team, this team, was so completely engaged. We won national awards for the community engagement within our PCORI grant. When we did our meetings with our project officers at PCORI, we had somebody from this group on the phone, you know, parents on the phone, telling the people at PCORI what we were doing right, what they'd like for us to do better. And every time we met with them, the next meeting, we said, here's what we changed because of what you said. So that everyone understood that we're not just listening and deciding what we're going to do. We are actually changing what we do because of what you're bringing to the table, because you're a co-investigator, because you're part of the team, not an advisor, but a part of the team. And that is the approach to true engagement that I think we fail at a lot of the time, and that leaves our communities unhappy when we walk away. So I just wanted to share that experience from that standpoint with this group. So I'll stop there. Thank you.